As a health educator, I want to begin by speaking honestly and calmly. A stroke is not rare in older adults, and more importantly, many strokes happen when a person is alone. Seniors often ask me this question: "Doctor, what if a stroke happens when no one is around me?" This question matters because what you do in the first few minutes can change the rest of your life. Stroke is not only about survival, it is about whether you can walk again, whether you can speak clearly, whether you can live independently. The goal of this video is not to scare you. The goal is to prepare you calmly so that if something happens, you already know what to do, without panic. Let me explain what is happening inside the body during a stroke. Your brain depends on a constant supply of blood and oxygen. A stroke occurs when a blood vessel supplying the brain becomes blocked or a blood vessel ruptures and bleeds. When blood flow stops, brain cells begin to suffer within minutes. Brain cells do not regenerate easily. This is why doctors say, "Time lost is brain lost." The faster treatment begins, the more brain tissue can be saved. Why strokes feel confusing at first? One reason strokes are dangerous is that they often start mildly. You may feel slight weakness, a strange sensation in your face, trouble finding words, mild dizziness. Many seniors think, "I'll sit down and rest. It will go away." But this delay is one of the biggest reasons strokes cause long-term damage. Stroke symptoms may improve temporarily and then worsen suddenly. Step 1. Recognizing stroke symptoms. The first and most important step is recognition. Stroke symptoms often affect one side of the body. You may notice one side of the face drooping, weakness in one arm or leg, numbness or tingling, slurred or unclear speech, difficulty understanding words, sudden vision changes, sudden loss of balance. These symptoms may appear suddenly or build over minutes. Even if symptoms feel mild, do not ignore them. I want to be very clear here. If something feels suddenly wrong, trust that feeling. Step 2. Call emergency services immediately. If you suspect a stroke, your first action must be to call emergency services. Do not call a neighbor first. Do not call your child first. Call emergency services. Emergency responders can begin treatment on the way, inform the hospital in advance, save valuable minutes. Do not worry about being embarrassed if it turns out not to be a stroke. Doctors would much rather see you early than too late. Step 3. Unlock your door. If you are alone and able to move safely, unlock your front door. This allows emergency teams to reach you quickly. Do not rush. Do not walk far. If you cannot unlock the door safely, stay where you are. Step 4. Sit or lie down safely. Once help is on the way, you must protect yourself from injury. Sit down in a stable position or lie on your side. Avoid standing or walking. Falls during stroke are very common and can cause serious injury. If lying down, turn slightly on your side. Keep your head slightly elevated. Avoid lying flat if nauseous. Step 5. Do not eat, drink, or take medications. During a stroke, swallowing may be impaired. Eating or drinking can cause choking. Do not take aspirin unless instructed by medical professionals. Some strokes involve bleeding, and aspirin can worsen bleeding. Let doctors decide the treatment. Step 6. Stay calm and control breathing. Panic increases blood pressure. High blood pressure can worsen brain injury. Focus on slow breathing. Breathe in slowly. Breathe out slowly. Remind yourself, help is coming. Step 7. Note the time symptoms started. Doctors rely on timing to make treatment decisions. If you can remember when symptoms began, when you last felt normal, this information can determine which treatments are safe. What not to do during a stroke. Do not drive yourself. Do not shower. Do not sleep. Do not wait for symptoms to pass. Waiting is the most dangerous decision. Preparation. Tips for seniors living alone. Preparation reduces fear. I recommend keep phone nearby, save emergency numbers, keep doors easy to unlock, inform neighbors. Preparation does not mean fear, it means confidence. A stroke is a medical emergency, but not a moment for panic. Calm action saves lives. Knowing what to do before it happens makes all the difference. Share this video with someone you care about. Subscribe to Senior Health Signals for calm, senior-friendly health education.